coming up.
Do you know that Fair Price Pharma arranged for the importation of 15 kilograms of heroin into Canada?
So you think that having a record number of overdose deaths in the first year of a pilot project and having a premier beg the federal government to eliminate public drug use because it's been such a failure and people having to climb over needles to get to children's playgrounds is a success?
Dr. Perry Kendall, he was BC's public health officer before you, 99 to 2018. Is that true?
He was the provincial health officer. That's correct.
You seem to have some trouble with this, but the Vancouver Sun reported that in 2020, after retiring as the public health officer, he co-founded Fair Price Pharma. Is that true or is that not true?
This guy's garage. Like and subscribe.
Dr. Henry, you've said multiple times in the media that diversion is happening. Is that true?
We have to recognize that this is a symptom of unmet needs, and we know that there are many different types of people sharing their drugs with others who don't have access to systems. And so we have heard that this has happened. It's happened before. We had our
thanks for that, Dr. Henry.
And it
thanks very much.
Happen.
So diversion is happening. We know that. The question is, the leading cause of death in children 10 to 18 in British Columbia is, could you remind the panel what that is?
It's the toxic drugs that are on the street right now.
It's overdose, is it not, Dr. Henry?
It's the toxic drugs that are on the street right now.
So you can tell this panel equivocally that no so-called safe supply is part of the overdose deaths in 10 to 18-year-olds in your province.
Well, you will have known that the chief coroner just put out a report on that this week. And while hydromorphone, which comes from a variety of different sources, was there in a small percentage of young people who died, it was not the sole substance found and was not the cause of death. The cause and the challenge.
Thanks for that, Dr. Henry. You know, the big thing. Excuse me, Dr. Henry. You know, what we do know is that hydromorphone has been found in 10 to 18-year-olds who have died in your province due to overdose. That's disturbing to me.
Has not
I don't think that I asked you a question, Dr. Henry. Dr. Henry, excuse me. This is my time to ask you questions, so please, if you would be respectful of that and answer the questions, that would be incredibly helpful. When we talk about legalization, has the import and supply of heroin ever been allowed in Canada?
I'm not sure what the question is. Are we talking about legalization?
Well, we probably should be, because I believe in your statement, ma'am, you've said what we're doing with legalization around cannabis, etc. You also talked about monitoring safety of the product. So in the long term, that would be a way to counter the toxic street drugs and take away business from organized crime. Absolutely. So it would appear from that, ma'am, that you are a supporter of legalization. Is that true?
I think what has got us into the situation that we're in is prohibition, and we've seen that in many different situations over time. So we saw that with alcohol prohibition, we see this with cannabis, and I think legalization and regulation minimizes harms.
So you would be a supporter of legalization of hard drugs such as opium, heroin, cocaine, methamphetamine?
I don't think the term hard drugs is a term that
I don't think that I asked you that, ma'am. What I asked you is, would you be a supporter of legalization of hard drugs such as methamphetamine, cocaine, heroin, and opium? Would you support that?
I believe that legalization and prohibition is the cause of the issue. So legalization and regulation minimizes harms of all drugs.
Is that a yes or no, Dr. Henry? You're being very obtuse in your answer.
I'm not being obtuse. I'm being truthful in what I believe, which is that prohibition is one of the causes.
So the question is, Dr. Henry, is would you support legalization? I'll ask you the third time.
I support legalization and regulation of drugs to minimize harms.
Do you know of the business called Fair Price Pharma that exists in your province?
I know of it.
And do you know that Fair Price Pharma arranged for the importation of 15 kilograms of heroin into Canada?
That would be under the Health Canada regulations.
I didn't ask you about the regulations. I asked you if you knew that they imported 15 kilograms of heroin.
No, I did not.
Thank you. Do you know a person named Perry Kendall?
Of course I do. Perry Kendall was the provincial health officer in British Columbia.
And have you ever met with Mr. Kendall?
I meet with him regularly.
And is it true that he is the founder of Fair Price Pharma?
That's not correct.
That is not correct. Oh, okay. Fair enough. Does he have any relation with Fair Price Pharma?
Not that I'm aware of right now.
Has he had in the past?
He has had in the past, I believe.
And so he was an official in your government, not that you're the premier there, but he was an official in your government, and now he runs a company which has imported heroin into Canada. Is that true?
No, that's not correct.
That's your time, Dr. Ellis.
Dr. Henry, I was wondering if you could tell us how many publicly funded treatment beds are in British Columbia.
I don't have that data, but I can get it to you.
The answer is 3,663. Sorry. Do you know how many people are prescribed safe supply in British Columbia?
The last we checked, the Prescribed Alternatives program had about 4,000 individuals.
So do you think that it's appropriate that there is easier access to drugs than to treatment?
I don't think those are in competition with each other. There are things that work together, as we've heard about. We need a suite of things, and people accessing pharmaceutical alternatives. We know that from the data, and I refer again to the report that I put out. We talked to a lot of people about this, and the most of the prescribed alternatives are being used in combination with OAT. So that is people being able to get into treatment.
What's the average wait time for someone to be able to get into detox in British Columbia?
Well, that would vary, and maybe Dr. Bach would be able to give you more details around that. But it varies, and one of the
Dr. Bach, if you can answer that would be great.
Now,
certainly, it's going to vary tremendously depending on needs. Part of the road to recovery model has been streamlining that access. So for people who are deemed high priority, it's 24 to 48 hours for those who and certainly can be longer for those who there's a prioritization process. But for anyone high risk, youth, people high risk of overdose, generally within 48 hours in Vancouver Coastal Health at least.
According to the RCMP in British Columbia, nearly 2/3 of the detachment served communities do not have drug rehabilitation or treatment programs available. Do you think that's acceptable? Dr. Henry?
Of course not. We want access to treatment programs across the province, and we've been working to scale up that access as programs that Dr. Bach mentioned for people to be able to access them anywhere in the province and have remote support, for example.
Do you think that decriminalization has been a success in British Columbia so far?
I think parts of it certainly have. With any change in policy that's like this, there are always unintended issues that come up, and we need to be pragmatic and address those.
So you think that having a record number of overdose deaths in the first year of a pilot project and having a premier beg the federal government to eliminate public drug use because it's been such a failure and people having to climb over needles to get to children's playgrounds is a success?
I'm not sure exactly what you're talking about, but I think we also have to recognize that long-standing personal, social, structural stigma that keeps people silent about their drug use and creates these barriers is not going to go away in a few months or even a year. So this is one of a suite of measures that we need to do to take away some of those barriers that allow people to reach out and connect.
Thank you. Were any studies done on the impacts of children seeing open drug use before the legalization project went into play in British Columbia?
I'm not sure what you're referring to. We don't have a legalization project.
Were any studies of public drug use on children done prior to going into this dangerous pilot project experiment?
I'm not sure what you're referring to, but one of the things that we do know is that
Kids are being
there is a
exposed to people
perception-
that are overdosed on the street. They're having to climb past needles on playgrounds. Parents are having to sweep the Abbotsford soccer pitch on a daily basis because they are exposed to drugs. I'm asking, was anything done by the government of British Columbia to look at the impact of that on the development of our children before embarking on this project? Yes or no?
Let's think about this, because there is perceptions and stories that we are hearing, and we have not seen any data that there has been increased public drug use before and after decriminalization.
Do you have young children?
I do not.
Because parents are contacting me on a regular basis, telling me about how they have to sweep the playgrounds for needles and drug paraphernalia like crack pipes before they let their children play on community playgrounds. Do you think that's acceptable, yes or no?
Of course it's not acceptable. We all have concerns about public perceptions and public use. But this has not changed because of decriminalization of people who use drugs.
Thank you, Dr. Henry.
Thank you very much, Chair. And back to you, Dr. Henry. Dr. Perry Kendall, he was BC's public health officer before you, 99 to 2018. Is that true?
He was the provincial health officer. That's correct.
And you seem to have some trouble with this, but the Vancouver Sun reported that in 2020, after retiring as the public health officer, he co-founded Fair Price Pharma. Is that true or is that not true?
He was involved with it. I don't know his exact nature. He was involved with it. He is no longer involved with it.
Right. I'm sorry. What did you just say?
As far as I am aware, he is no longer involved.
He was one of the co-founders of this company that imported 15 kilograms of heroin into Canada.
You must remember that any importation of drugs into Canada is done
Dr. Henry,
under
please,
Health Canada.
This is not your stage to grandstand. This is to answer some very pointed questions. So the questions would be he was the co-founder of a company that imported 15 kilograms of heroin into this country. And the answer, of course, is yes. Do you know a Dr. Mark Tyndall?
I do know Mark Tyndall.
And is it true that he's the former executive medical director of the British Columbia Centre for Disease Control?
That's correct.
And former deputy provincial health officer under Dr. Kendall. Is that true?
That's correct.
And he started a company called My Safe Society. Is that true?
I don't remember the name of it. It could be.
Okay, well, let's say it this way then. He started a company to supply so-called safe supply harder morphone from vending machines. Is that true?
From biometric machines, I believe so, yes.
Fair enough. And that company then received $1.3 million from Health Canada's SUAP funding.
I'll take your word for it.
Well, thank you for that.
You're asking me for things that are not the details that I'm aware of or that I know of.
They're happening in your province, though, and you are the chief public health officer. That company also received $3.5 million in funding. Thank you for that. And that being said, are there other companies that you know of in Canada that have the dealer's license to legally possess, produce, sell, and distribute drugs such as opium, heroin, cocaine, and methamphetamine?
You would have to ask Health Canada that.
You are not aware of any of those companies?
This is not an area of my expertise. I
didn't ask if you were an expert. I asked you if you were aware of any.
I imagine there are. I don't know. Those are not areas that I focus on.
So what you would tell Canadians is that you have no idea that these companies exist, even though many of them are located in your province.
I would say that all of the companies, and as part of my role as provincial health officer, I don't meet with industry, whether it's industry related to drugs or industry related to vaccines or any other thing. So those are not areas where I have knowledge, detailed knowledge of companies.
Thank you. Dr. Henry, you recommended a non-medical model for safe supply. Do you have any examples of that you would have recommended to Canadians?
Well, we've been working on this, and I mentioned this when it's public knowledge when I came out with my report in February, that I think we need to look at all options around providing people with alternatives to what's toxic on the streets right now. And I have a report that we've been working on that will be coming out in the next few months on that.
Do you recommend compassion clubs like the one run by the Drug Users Liberation Front?
I don't recommend any specific model. I think we need to continue
You're
the
okay
conversation on what models.
You're okay with the Drug User Liberation Front, though. That would be a model that you would perhaps support?
I'm not supporting any specific models. I think we need to look at all of the options that are available that have the important regulations around them and support them.
Dr. Henry, to me it's very concerning that many individuals who were former officials of the British Columbia government, and indeed people have occupied your position, are now involved with distributing, selling, and dealing drugs such as meth, cocaine, heroin, etc., and profiting from it. Is that okay with you?
I don't. I think what you have to do is separate between legal use, and that is under the purview of Health Canada.
Supporting these individuals, they did your job, and you're actually saying, "Hey, we should legalize more drugs in Canada." That's your pitch to Canadians, and oddly enough, these individuals are actually profiting from it. To me, that convinces me there's a significant conflict of interest here, Dr. Henry.
What I have always said and what I continue to say is that prohibition is one of the leading causes of the issue that we're in right now, and that legalizing and regulating is one way to manage the illegal and toxic drug crises that we're dealing with.
Does diversion scare you? Are you concerned by diversion?
I think diversion, as I've said many times, is a symptom of unmet needs. And in the case of the unmet needs that we are seeing, it is very concerning to me. It means that we need to take different approaches. But I also want to recognize that diversion is not new. We've seen that in many parts of this country. In BC, the toxic drugs on the street has been the proximal cause of what we've been dealing with.
I just want to think. I have very limited time. So, do you think having more drugs on the street will solve an addiction crisis?
I don't think we're having more drugs on the street. What we're seeing is the toxicity of the drugs on the street has been driving this crisis.
Okay, so based on kind of rough math, there's about 50 million safe supply hydromorphone pills prescribed in British Columbia every year. How many of those 50 million pills would be acceptable to be diverted into the hands of gangs and people who are profiting off the death of Canadians?
None would be acceptable in that circumstance.
Okay. How many would be acceptable to be diverted into the hands of youth? You're on mute.
None of us want youth to be taking drugs. And we know that taking prescription drugs is something that we have seen for many years in young people, and that's often where people start.
So, because of that, what has the government of British Columbia done to reduce diversion to prevent these potent drugs from getting into the hands of kids?
Yeah, that is one of the things that we need to pay a lot of attention to. So, what is it that gives young people the strength to understand what's out there, to go against peer pressure?
I understand all of that, and peer pressures existed for time immemorial. My question is, what has the government of BC done since they've introduced 50 million pills of hydromorphone, a highly potent synthetic opioid that is stronger than heroin, into the market? What have they done to prevent those pills from getting into kids' hands? Has anything happened
I'm
to
not
prevent it
sure.
from getting into kids' hands?
Of course we have, and with the programs that we have that are prescribed, safer supply means that people have a prescription. They have a relationship with the prescriber to access medications. And we know that there is people who share medications, people who keep their drugs.
Do you think
because they
people
need them
sharing-
for different times?
Do you think people sharing their safe supply is compassionate? We've heard that from one witness here.
I think in some cases it is. It's a symptom.
So as a medical
of
doctor-
unmet needs.
As a medical doctor,
People who can't access.
as a medical doctor, are you comfortable with people sharing their safe supply with another person that's struggling with addiction?
I think it is a better alternative than the street drugs that people are required to access to maintain their addictions, and that's the challenge. The challenge is that we have unmet needs.
So
that
you're
people
okay-
cannot access.
So just to clarify, you think that it is fine to divert your prescribed safe supply as long as that person you're sharing it with has unmet needs? It's absolutely A-okay, even if it's a teenager, even if it's a child.
Yeah, I think you're trying to make this into something that is a scenario that is not what we're dealing with. And what we're dealing
But
with
it is
are
what we're
people
dealing
who are
with. It's
not
what we're
able
hearing.
to access programs. So we do need to do better at providing people with the medications they need to get them on that road that
What
we
is-
all want people to be on of recovery.
What is the wait time approximately for a child, 12-year-old in Cranbrook, British Columbia, to get access to detox?
I don't have an answer to that question.
Do you think it should be immediate?
Absolutely, if
Do you-
that child needs it.
So do you think
if
a
that
child
needs it, they
that
should
is-
have access to supports from somebody who is trained to
Okay.
understand their needs
So
and is able to support them.
a child that is addicted to drugs that ends up in the ER in Cranbrook, Alberta, in Cranbrook, British Columbia, do you think that they should be released because there is no detox space available?
I think they need to have a relationship with a provider that supports them for their needs at that moment. Absolutely.
Thank you.
Desperately seeking help is meeting their needs?
I'm sorry, I couldn't hear that question. It was cut off.
Do you think releasing someone that is desperately seeking help is meeting their needs?
I think it depends on the situation that that person's in, and absolutely, we want all children to have the supports and the connections that they need.